Hello. Yeah, I'm Dr. A. Santosh Kumar. I'm a consultant nephrologist and a transplant physician working in LB Nagar, Kamneni. So today I'll just briefly talk about what is the causes of what are the causes of pedal edema in chronic kidney disease, and what are all the symptoms which can have patients can have. What is the treatment which is there? First of all, what we need to understand is what is chronic kidney disease. Chronic kidney disease is ideally defined as whenever you have decreased GFR, that is the glomerular filtration rate has come down, which is consistently present for a period of at least a period of 3 months. When we have checked for at least 2 times, it has to be checked. So this is to put it very simply, it's like there is a permanent degeneration of the kidneys, wherein the kidneys start reducing in function as the GFR, as the functioning starts coming down. There are a lot of changes which keep on happening, and a lot of bad products or excretory products which keep on accumulating in the body, leading to diseases and its manifestations. So what do the kidneys actually work for? The kidneys actually take care of something called as homeostasis. In the sense, they maintain the electrolyte balance and the mineral balance which is there, or the water balance which is there in the blood, throughout the blood, and even throughout the body also they'll be maintained. So blood is kind of circulating system which just keeps on equalizing whatever is there in the body. If there are some abnormalities which are there in one part of the body, it gets regularized, or it gets flushed out, or it starts clearing up completely. So here what happens is, whenever the kidneys are not functioning, then the accumulated products, the excretory products which are supposed to go into the urine, they start accumulating in the blood. And then you can start, either you can start in the early stages, you can start seeing through the reports itself, or sometimes with the presence of any of the symptoms also they can have it. Apart from maintaining the homeostasis, the kidney also functions in maintaining the hemoglobin level, or the type of red cells which are there. It also maintains the acid-base balance which is there, and it also takes care of the overall immunity of the person also. So how do we define the stages in the chronic kidney disease? The chronic kidney disease, what happens is, as the GFR starts coming in, they have been arbitrarily defined into 5 stages. So stage one is like, if the more than 90 GFR is there, then you call it stage 1. 2, it is almost more than 60%, 60 GFR is there. Third is whenever stage 3 is actually divided by into 2 types, that is 3A and 3B. More than 30 GFR and more than 30 to 45 GFR is called as stage 3B. 3A is when you have a GFR of more than 45 up to 60. 4 will be up to 30, more than 15% to 30%, or just less than 30%. Stage 5 or is almost like end-stage renal disease, wherein the functioning of GFR has dropped down to somewhere near 15%. As the kidney starts decreasing in function, the symptoms also gradually keep on increasing. So the symptoms, usually the kidneys are like they're one of the best organs which are there. So it's like though you have any other, it's almost equally complex to that of brain. So it's like multiple small filters are present. They're present throughout the body, throughout the kidney, and each kidney will have almost 10 lakh filters, or almost 10 lakh filters are present in each kidney. So that's like 1 million nephrons are there, or 1 million microfilters. The glomeruli are nothing but microfilters which are present in each kidney. So as the severity of the kidney disease starts increasing, what we start noticing are newer symptoms will start appearing. Again, depending on the type of chronic kidney disease, if the patient has a lot of protein loss in urine, they start developing a lot of edema. In extreme, the other type of disease which is there is called chronic interstitial nephritis. So if the filter starts getting damaged early, then we call it as chronic glomerular nephritis. In the tubules which are there, after the filter, the type of other tubes which are there, which are in series, and they start regulating the urine production, etc. If those get damaged, we call it as chronic interstitial nephritis. So initially, whenever you have glomerular disease, you start developing a lot of accumulation of the water because the tubules are functioning properly. If the tubules are open, which are not functioning properly, you have a lot of losses of water which is happening, which presents as either increase in urine output, or sometimes with changes in the electrolyte abnormalities, and acid-base balance can be present. Glomerular nephritis most of the times are present with pedal edema, retention of fluid, a lot of salt accumulation. So most either volume or load. With this sort of presentation, what happens is fluid accumulation leads to either swelling of the excess water in the body, leads to accumulation in wherever gravity aided, or it's like almost the patient is in the sitting position for a longer duration, the water starts accumulating in the feet. Or if the patient is in lying down position, loose tissues like periorbital region, etc., they start swelling up. And as it keeps on increasing, Then the patient start noticing that pedal edema, swelling of feet has increased, it has gone to the thighs, or sometimes abdominal distension is there, and they start also noticing that late signs they start developing shortness of breath. You have something called a redistribution of edema. In a sense, the swelling which is there in the legs alone, it starts getting redistributed to the abdominal area or into the facial area, or let's say in the thorax region, whenever the patient is in a lying down position for a longer duration. So the prominent symptom with which they present during this issue is that they start developing shortness of breath or discomfort during sleep up to 1 or 2 hours. So the earliest symptom of pedal edema would be the excess water which is there in the body. Is patient starts complaining, saying that they have swelling of feet late in the day, but they see that the edema has subsided whenever they lie down and when they get up in the morning time. So these sort of events keep on happening. Whenever they have excess of fluid which is there, retention will also cause sleep disturbances. Because of sleep disturbances, again, the pressures, BP might be on the higher side, and excessively sometimes they might also notice that they might keep on passing repeatedly. Urine passage will be on the higher side, so urea, etc., can be present. With this, the other type of symptoms which are there are in a patient who has chronic kidney disease are either loss of appetite or nausea, vomiting. So these are extremes of the nerves. In sense, we start seeing these symptoms in stage 5 CKD, whenever GFR has dropped down to less than 15%. So what happens is, what do you mean by saying pedal edema? Pedal edema is like abnormal buildup of fluid which is there in the ankles or feet and leg, and gradually it can happen if it is chronic kidney disease or any type of organ failure, so that the heart problem is there, heart failure is there, or liver failure is there, or kidney failure is there. So in these events, what happens is the swelling of feet starts happening in both the legs. If it is unilateral, that is, it is present in only one of the legs, you need to rule out whether any local causes are present. Sometimes it might be because of the venous drainage can be present, venous drainage abnormalities can be present, or local infections can be present, or third, sometimes lymphatic occlusions can also be present. So this also lead to the formation of swelling of feet only in one swelling of foot or one leg can be present. So, what sort of reasons can be present for edema in chronic kidney disease? So, in chronic kidney disease, what happens is main causes are, one thing is retention of, as the kidney starts functioning at a lower level, there is a lot of retention of fluid, a lot of retention of salt. So, whenever you have salt accumulation in the body, associatedly, the water also starts accumulating. That leads to edema. Or the second possibility is in chronic glomerulonephritis, sometimes they have a lot of loss of protein in the urine. With the loss of protein in the urine, what happens? Because there is significant loss of protein which is lost, the turgidity or ability of the blood to retain water is a bit less when compared to that of in the tissues. So that also leads to a lot of water accumulation within the skin or just below the skin. So the extremes of scenario is, apart from chronic kidney disease, you can have it in nephrotic syndrome. So excessive loss of protein which is happening. Patients start developing a lot of protein loss in the urine to that extent that the liver is not able to cope up with the losses which are happening. So because of that, the protein starts decreasing in the blood, and that leads to accumulation of the water in the kidney. So water in the body. The kidneys, how they assess is they start assuming, because they start maintaining homeostasis. As a sort of water loss happens, it becomes more on it senses that there is some amount of turgidity which is lost. So kidneys start accumulating more and more water to fill up the volume. So that leads to excess of volume which can be present. So as I said, initially, if the patient is there for a longer duration, pedal edema, if they are present for a longer duration, what they notice is they start noticing edema in the legs, predominantly in the late evenings also, they'll be starting noticing. So what are all the signs which you can see? Most of the times what they can see is they can see a small puffiness of the skin, or slight swelling can be present, or the skin might be a bit stretched or a bit shiny, and it starts retaining some. If you start pressing it, you might start developing, they can start creating dimples artificially if you are able to press for a slightly longer time. So that way we can recognize whether the patient is a bit volume overloaded or not. So what can be done to prevent the edema which is there? First of all, the main issue in this is because there is excess of water intake, water accumulation which is happening, and salt accumulation which is happening. So these two have to be controlled. That is, you need to tell the patients to reduce their salt intake and water intake. If you tell them to only reduce their salt intake and not water intake, or let's say salt, you're advising them to drink less without restriction in the fluids, that will obviously cause electrolyte abnormalities can also be present. So for this, what we need to do is we need to dietary modifications are more important. If let's say dietary modifications are not able to overcome the edema which is there, then we have to go ahead for adding a diuretic. So diuretic is a kind of drug which helps in removing the excess water which is there in the body, or it also helps in improving the amount of urine production which is there. So what we can do is whenever we start reducing the sodium salt which is there, that also helps in increasing the action of a diuretic as well. So whenever we start giving more and more diuretics, there is what we have to remember is it can also cause a bit of dehydration also if taken in excess. If the patients are not taking it properly, or if they responded very significantly, in the sense what we expect is at least 500 ml per day excess loss of fluid should be there, excess urine production should be there. If it exceeds, since they start producing suddenly 2 to 3 liters of urine within a day or two, or they start losing more amount of water than the edema which is getting, which means whenever you are giving any diuretic, the losses are happening from the blood. So the water which is accumulated below the skin, it has to enter into the blood again. So that sort of time duration which is there, that usually is very slow. So to increase that, what we can do is we can tell the patients to have either compression stockings, or we can tell the patients to lie down for a longer duration and in the lying down position itself. Or sometimes if the edema is a bit less and they don't have any cardiac dysfunction, etc., or they're not severely volume oriented, in those events we can also tell them to raise their legs slightly on the just above the heart level, so that the swelling which is there, it usually gradually drops in, or the swelling, the water accumulation which is there, that gradually goes in. Once it enters into the blood, the diuretic will take care and it starts pushing the water, excess water outside. So this, whenever we start doing it, these are kind of small things. That is, again, compression stockings also help a lot. Compression stocking help in improving the venous return to the body. So with that, they can actually, the edema will also start coming down. But the general problem or the kind of discomfort which is there is because it has to be worn for a longer duration throughout the day. Patients do feel a bit of discomfort. And in the presence of a chronic kidney disease, most of the times they'll have skin dryness which is there. With the skin dryness, there is always a possibility that they might also develop some or other skin lesions in the presence of a stockings. So lastly, what we have to remember is whenever it's not always possible to prevent chronic kidney disease. So controlling diseases, that is the reason why they develop chronic disease is always because of the primary causes. That is sometimes, most of the times, at least it is because of the diabetic kidney disease, or it is because of the high blood pressure. These have to be under control. The moment they are under control, the kidneys functioning also slightly would be better. So with a person who has very high sugars, sometimes with the TFR which starts dropping down, even if you start them on a diuretic, it might not respond. So what we have to do is we have to have a very good glycemic control. Very good sugar control is very important. So once we go ahead for very good sugar control, kidney functioning also starts improving. And with that, usually the edema which is there, that will also start disappearing. So if any person who is on at high risk for chronic kidney disease, that is a person who has either high blood pressure, or let's say they are diabetics, or family history of chronic kidney disease is there, or in those events, or let's say they have some sort of urological tract abnormalities, that is born with a single kidney, or there are some ureter problem is there, or bladder dysfunction. Those kind of individuals have to remember that they are at a high risk for developing chronic kidney disease, and they need to get regularly checked themselves so that they can recognize what is going on. And based on that, we can at least go ahead for early preventive therapy, or at least recognizing them at what stage they are developing, and we can also take care of further disease decrease in the complications also can be done. If let's say we are not able to take care of the edema, the swelling of the swelling, or the water excess which is there in the body, the consequences which are known are, if excessive water intake, what happens is it can also cause some amount of hypertension. It can definitely contribute to chronic. It can contribute to hypertension. With the progression of hypertension, there is always a possibility that chronic kidney disease will also progress rapidly. And third, more important possibility is because they are present for a longer, because the skin is a bit soft, there is always a tendency that either because of the dryness or because of the skin, patients will be going on, they have that itchiness sensation that might be, or because the tissue is also very waterlogged, that will be very soft. There is always a possibility that they might injure themselves. So any smaller injury which they develop in the presence of lot of edema, the infection also spreads very rapidly. At the same time, it can also cause, in a diabetics, that is one of the commonest cause for either the amputation of feet, or sometimes because diabetics also have associated neuropathy or associated vasculopathy is there. Sometimes they'll also have peripheral vascular disease. So because of this, they're at a high risk for developing gangrenous related infections, or gangrene can be prescribed because of multiple infections. They might have to go ahead for some sort of amputation, either digit amputation, sometimes more than that, the limb amputation can also be present. So these things you need to remember. So whenever a patient of chronic kidney disease is there, you have to go through step by step to identify what are all the causes. If edema is there, we need to see that the edema is under control basically initially itself, so that it doesn't cause much of a problem to distress to the patient, or we can go ahead for secondary prevention by going ahead with diuretics itself. And at the same time, further damage should not occur to the other waterlogged tissues which are already there. Hopefully, by this talk, I think you should have understood basically what is CKD, or at least what sort of edema changes will be happening in these individuals, and that help at least a little. Means there are a lot of diuretics which can be present, but it has to be customized to each individual. I won't go into the details of how to treat a patient, because everyone will be having an idea. At least doctors, they'll have an idea about how to go ahead for the treatment part of it. The main issue is see that you take care of the edema properly. Thank you.